Just a couple items for you all at the top. Another update on the hurricane. The continuing focus on the ground is on power restoration, as nearly 1 million customers in Louisiana, more than 40% of the state, remain without power in the middle of a heat advisory. While progress has been made in Mississippi since yesterday, 30,000 customers there still do not have electricity, and power restoration in parts of Louisiana could take weeks as crews assess the full extent of power system damage. To help accelerate these efforts, the President spoke with CEOs of the largest energy companies in the Gulf Coast yesterday and committed the full weight of the federal government to providing resources wherever they are needed. As part of that, the federal government is sharing aerial and satellite imagery to support damage assessments, helping with debris removal and traffic control so restoration workers and equipment can get access to downed wires and poles, and expediting permitting for rerunning of transmission cable across the Mississippi River and for standing up transmission towers. Federal personnel from DOE, the Army Corps of Engineers, and across government are on the ground assisting efforts, along with, as I've noted previously, 25,000 linemen. Lack of power and damage to the healthcare facilities in Louisiana remains a significant problem. We are prioritizing the deployment of generators to locations most in need, and about 1,800 patients as of today have been evacuated from healthcare facilities with the help of additional ambulances that were pre-staged by FEMA. Cell service also remains an issue, as it has been over the course of the last couple of days, and the FCC is working directly with wireless carriers and has deployed staff to Louisiana to prioritize recovery efforts. We know this has been incredibly difficult, continues to be for many people who had to evacuate because of the storm, and we continue to encourage individuals from impacted areas in Louisiana to apply for federal assistance. More than 31,000 households in Louisiana have already received a one-time $500 payment to support critical needs as a result of the major disaster declaration the President approved. I'd also note, this just went out, but in case you haven't seen it, on Friday the President will travel to New Orleans, Louisiana to survey storm damage from Hurricane Ida and meet with state and local leaders from impacted communities. We're just finalizing the details of this trip, so as more become available, we'll share them with all of you. Also wanted to note that today, the White House and agencies across the federal government, including HUD, Treasury, and the Federal Housing Finance Authority, are announcing steps that will create, preserve, and sell approximately 100,000 additional affordable homes over the next 3 years, with an emphasis on lower and middle ends of the market. These steps leverage existing authorities and dedicate additional resources to affordable housing. Specifically, they will boost the supply of quality, affordable rental units by increasing the financing available through HUD, Treasury, and FHFA programs for affordable and targeted housing production, including a relaunch of the Federal Financing Bank's risk-sharing program, expanded support for low-income housing tax credit, and increasing access to the Capital Magnet Fund. This will boost the supply of manufactured housing and 2 to 4 unit properties by expanding financing through Freddie Mac, which, along with existing policies, will enable more Americans to purchase homes. Last item, sorry, there's a lot going on today. Today, the White House, Treasury, and Code for America, a civic technology nonprofit, announced the launch of a new mobile-friendly and bilingual child tax credit CTC sign-up tool that is mobile-friendly and available in Spanish to make it even easier for more Americans who do not regularly file taxes to claim their child tax credit. And as you know, this has been an ongoing effort of this White House and the administration to reach every single person we can who's eligible, even if they are non-filers. We will link this new tool through childtaxcredit.gov, while the Code for America tool is an important and necessary resource to help more families this tax season. Treasury remains committed to creating a permanent, fully resourced, multilingual, and mobile-friendly government sign-up tool. That is a process that is underway. That is all I have to highlight for you this morning or this afternoon. Go ahead, kick us off.
Great, thanks, Jen. 2 subjects. First on COVID. In Louisiana, state data suggests that about 10% of hospitalized patients are vaccinated. Is it still accurate to call COVID a pandemic of the unvaccinated? And could that phrase that's been deployed frequently by the White House possibly be counterproductive at this stage to protecting some Americans?
Well, I would say first, we continue to track data closely through the CDC and all of our health and medical experts who do show that across the country, the vast majority of those who are hospitalized, vast majority, are individuals who have not been vaccinated. That has not changed. And any health and medical expert, whether it's Dr. Fauci, Dr. Collins, Dr. Walensky, will tell you that vaccination is very effective in protecting from hospitalization and death and serious illness. That is our objective, is to save more lives. So that hasn't changed our messaging.
Secondly, obviously in Texas with the law with regard to abortion, the president said in a statement he will protect and defend Roe versus Wade. How does the administration plan to do that?
Well, we put out a statement from the president this morning, but let me just reiterate some of the key points, and I will, of course, answer your question. As the president said this morning, this extreme Texas law blatantly violates the constitutional right established under Roe v. Wade and upheld as precedent for nearly half a century. It will significantly impair women's access to the health care they need, particularly for communities of color and individuals with low incomes. It also deputizes private citizens to bring lawsuits against anyone who they believe has helped another person get an abortion, which might even include family members, healthcare workers, front desk staff at a healthcare clinic, or strangers with no connection to the individuals. This further isolates individuals who are facing this tough choice. And I would note, for those of you who didn't see, people who report who these private citizens could get up to $10,000 for reporting somebody who's seeking an abortion. So our focus and the president's focus is to reiterate our deep commitment to the constitutional right, of course, established by Roe v. Wade nearly 5 decades ago, and to continue to call for the codification of Roe, something that the president talked about on the campaign trail, the vice president talked about on the campaign trail, and this highlights even further the need to move forward on that effort. Go ahead.
Thanks, Jen. One on COVID and Afghanistan, a second one on Afghanistan, specifically the boosters. President Biden has pledged to follow the science in the fight against COVID, though some experts have expressed some concern. The decision to make boosters widely available this September is a bit premature, and that it was made before health experts were able to fully weigh it. So here's my question. What can you tell people who are concerned that the desire to get ahead of the virus has actually put us out in front of the science instead?
Well, first of all, we always lead with science. And let me just reiterate some things for anyone who's expressing a concern. This was a decision made by and announced by the nation's leading public health officials, everyone from Dr. Rochelle Walensky, the head of the CDC, Dr. Janet Woodcock, acting FDA commissioner, Dr. Francis Collins, NIH director, and Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases. They reviewed mountains and mountains of available data on vaccine effectiveness and made a clinical judgment that boosters would be needed and announced a plan to begin them in September, subject, of course, to the FDA and CDC processes to continue. We also know that there needs to be a plan in place to implement these booster shots around the country. But I will tell you that this was a recommendation made by our nation's leading health experts based on mounds and mounds of data. There will still be a final piece of this process that will be seen through, but our responsibility and our objective is to save more lives, protect more people, and as soon as this data, the science made clear that boosters would help do that, we wanted to put that information out to the public.
The September 20th date, is that firm, that date to roll out boosters, is that a firm date?
Well, it's based on and pending the final, subject to the final FDA and CDC processes, yes.
Okay, and then one on Afghanistan. There's some reporting that we'd like to confirm regarding a call in July, between President Biden and former Afghanistan President Ghani. One, that both leaders appeared completely unaware that the Taliban would take over, and secondly, that they discussed plans to project that Afghan forces were still in control. Is that accurate? Can you tell us a little bit more about that call?
Well, I'm not going to get into private diplomatic conversations or leaked transcripts of phone calls. But what I can reiterate for you is that we have stated many times that no one anticipated, the vast majority, I should say, there may have been individuals and agencies, so I don't want to eliminate that option, but our national security team and no one in Congress Or I would say most people out in the public anticipated that the Taliban would be able to take over the country as quickly as they did, or that the Afghan National Security Forces would fold as quickly as they did. So even the content of the reporting is consistent with what we've said many times publicly. I'll also note something that the president said in his press conference around the same time of this reported phone call. The Afghan government and leadership has to come together. They clearly have the capacity to sustain the government in place. The question is, will they generate the kind of cohesion to do it? And what the president conveyed publicly and certainly privately as well, repeatedly to Afghan leaders, as did our national security officials, is that it's important that the leaders in Afghanistan do exactly that, lead, and show the country that they are ready to continue to the fight against the Taliban, that they have the will for the Afghan National Security Forces to continue that fight even as our U.S. forces leave.
Did the president at that point in time have some sort of a perception that even the former president of Afghanistan didn't have that confidence in the Afghan forces? Is that why maybe he was pushing Ghani to be more stern and to be more confident?
The president has consistently conveyed, and I just noted an example publicly, that the Afghan leadership at the time needed to do exactly that, lead. They needed to come together in a cohesive manner. They needed to be united. They needed to show the country and the Afghan people they were going to fight and they were going to lead through this transition, even as U.S. forces left. That is entirely consistent with what he has said publicly throughout. Go ahead.
Thank you, Jen. One on Afghanistan, one on COVID as well. A few colleagues of mine have determined that there's roughly 17,000 Afghan refugees in military installations in 5 states here as of Tuesday, while another 40,000 remain at bases overseas. Curious, how many of those Afghan evacuees have other countries committed to resettling, or what is the status of those ongoing conversations? And will the U.S. resettle, or otherwise, will the U.S. resettle all of those 40,000 here in the United States?
Well, not to refute the reporting of your colleagues, but just to note, the Secretary of Defense just confirmed it's about 20,000 who have come into the United States at a briefing earlier this afternoon. There is capacity, and we are working towards capacity at our military bases for up to 50,000. And again, this is not a place where people would live. This is a place where people would go. They would receive medical care and assistance and get connected with refugee resettlement organizations that are play a vital role as refugees come to our country from wherever they come around the world. We are also working with third countries on what their capacities are. I can't give you an exact breakdown now. It's a very important question, but that's exactly what our Department of Homeland Security, what our diplomatic team will be working through in the coming days, and I'm certain they will be providing updates as we have that established.
You've talked about this a little bit, others have as well, but there are, of course, concerns among lawmakers, experts who've tracked this. They're saying previous arrivals of large numbers of refugees from different parts of the world, inevitably there may be a handful, small handful, who are eventually deemed a security risk of some kind. What reassurances can you make about the screening process and the attempts to make sure that somebody like that doesn't make his or her way here?
I can absolutely assure you that no one is coming into the United States of America who has not been through a thorough screening and background check process. And there are many individuals, as you noted, who have not been through that process, and they have gone to lily pad countries as that process has been completed. It doesn't mean that that's because there's a flag. It means they have not completed their paperwork, and we were working to save tens of thousands of people, hence we evacuated them to these third countries.
And then on COVID, is there any update on the U.S. decision to keep Europeans and Canadians from visiting the United States? There were a few public messages from ambassadors here in Washington, the EU ambassador, the Polish ambassador, among others, saying the time has come for vaccinated Europeans to be allowed entry into the United States. Our people deserve to be reunited with loved ones and to have the opportunity to visit this great nation. I know this is something a lot of people worry about. Just curious if there's a status report.
Well, we certainly understand that and relate to that and know that people are eager to be reunited with loved ones, and that is something that's impacting many people around the world. I would note that we are right now working across federal agencies to develop a consistent and safe international travel policy. That has obviously been ongoing for some period of time. That includes travel from Europe and other countries around the world. And it is one that we want to be equitable. We want it to have standard requirements so there's clarity And so there's equity across how we approach it. This will involve, of course, efforts to step up protecting the American people. It may also involve ensuring that over time foreign nationals coming to the United States are fully vaccinated with limited exceptions. No decisions have been made yet, but that is a process that's ongoing. We certainly understand the interest in it being resolved and completed.